Bone and joint health is essential for mobility and consequently, for maintaining quality of life, though it often only becomes a concern as time passes and problems begin to appear. Among the main conditions that affect bones and joints are osteoporosis, arthritis, and osteoarthritis, each with specific characteristics and impacts. Osteoporosis is a disease that affects the bones, making them weaker and more prone to fractures. Over time, bone tissue wears down, and bone density decreases, increasing the risk of fractures, especially in the vertebrae, hips, and wrists. This issue is silent and is usually only diagnosed after a fracture. Women, especially after menopause, are more susceptible, but men can also be affected, particularly from age 50 onward. Lack of calcium and vitamin D in the diet, as well as a sedentary lifestyle, smoking, and excessive alcohol consumption, are risk factors. Countries like the United States, Japan, and European nations have high rates of osteoporosis due to their aging populations. Joints, on the other hand, can be affected by two common conditions, arthritis and osteoarthritis, which are often confused but have different causes and treatments. Arthritis is an inflammation of the joints that can have an autoimmune origin, as in the case of rheumatoid arthritis, or be caused by infections, injuries, or other health problems. It can affect people of any age, though it is more common after the age of 40. This inflammation can cause pain, swelling, and stiffness, affecting the hands, knees, hips, and spine. Developed countries, such as the United States, the United Kingdom, and Canada, have a higher prevalence of rheumatoid arthritis, associated with genetic and environmental factors. Osteoarthritis, on the other hand, is a degenerative joint disease that occurs mainly due to the wear and tear of the cartilage that covers the ends of the bones. Over time, this wear causes pain and stiffness and is more common in people over the age of 60, aggravated by excess weight, previous injuries, and physical activities that put a lot of strain on the joints, such as high-impact sports. Osteoarthritis most commonly affects the knees, hips, spine, and hands. Countries with high obesity rates, such as the United States and Brazil, have a higher incidence of osteoarthritis since excess body weight puts more pressure on the joints. Diet plays a crucial role in both the prevention and treatment of these conditions. For those suffering from arthritis, it's important to avoid foods that may increase inflammation, such as refined sugars, fried foods, processed foods, and excessive red meat. On the other hand, a diet rich in omega-3 fatty acids, found in fish like salmon and sardines, walnuts, and chia seeds, can help reduce inflammation. Foods rich in antioxidants, such as fruits and vegetables, are also beneficial, always bearing in mind that organic options are preferable due to the potential pesticides used in conventional farming. For osteoarthritis, the priority is to keep cartilage healthy. Consuming collagen, gelatin, and nutrient-rich broths can help in this process. Foods rich in vitamin C like citrus fruits and broccoli also aid in collagen production. Maintaining a healthy weight through a balanced diet and engaging in low-impact exercises, such as swimming and cycling, is essential to relieve stress on the joints. In both cases, the intake of calcium and vitamin D, along with vitamin K2, is crucial to keep bones strong. Dairy products, such as natural yogurt, as well as dark leafy greens and almonds, are good sources of calcium. Vitamin D can be obtained through sun exposure or from foods like eggs, fish, and fortified foods. Supplements can be useful to minimize damage and relieve symptoms of both osteoporosis and joint diseases. Calcium and vitamin D supplements are widely recommended to prevent and treat osteoporosis, while glucosamine and chondroitin may help improve joint health in cases of arthritis and osteoarthritis. In some cases, doctors may also recommend hydrolyzed collagen or omega-3 supplements. And as always, a basic recommendation: consult doctors and nutritionists and follow the exams they recommend. These health issues affect millions of people worldwide, and the aging population, combined with poor dietary and lifestyle habits, increases the incidence of these diseases. In countries like Japan, where the elderly population is growing, osteoporosis is an increasing concern. In the United States, where there are high obesity rates, joint conditions are a significant public health problem. In Brazil, the aging population and increased sedentary lifestyle are also risk factors for these diseases.
If you enjoyed our video, don't forget to leave a like, subscribe to the channel, and recommend it to your friends and family.